Z codes in ICD-10-CM are status codes. They're used for things like if a patient has an encounter for allergy testing, if they have inadequate sleep hygiene, or maybe a family history of eye disorders. They're used to tell more about the patient's story, but aren't necessarily a sickness or a condition. So how do you recognize them and know when to use them? Well, that's what we're going to cover in today's video. I'm Victoria Mull. I'm a medical coder, auditor, educator, and content creator, and on my channel, I provide tips, tricks, and tutorials to help you be successful in a medical coding career. Today's video is sponsored by iCoder. With iCoder, you can have a world of medical coding tools and resources right at your fingertips. You can effortlessly look up CPT, ICD-10-CM, or HCPCS codes. You can enter a partial word, a full word, a fragment, a whole sentence if you want, and it'll give you all of the applicable codes for that search term. And it includes things like the rates, the RVUs, the global period. Whether you're a beginner or a seasoned pro, iCoder caters to all skill levels, so you can sharpen your coding abilities, stay compliant, and streamline your efficiency. But that's not all, because iCoder has some amazing resources that a lot of other tools don't have, where you can do things like not second guess yourself, because they have repair code calculators. They have an app where you can put in an NDC code from a drug and it will tell you the applicable billing codes. It's a really amazing tool that you can store right on your phone or access via desktop. So what are you waiting for? Sign up today at icoder.info. I'll also include the link in the description so you can get started. So what are Z codes? Z codes are codes in chapter 21. They start with the letter Z, and they're for things like health status, reasons for encounters, things that are not necessarily a sickness, illness, injury. So they're used for those instances where we have an encounter or some sort of service where the patient doesn't have that illness or injury, but we need to support the medical necessity, like why were they there, but it wasn't a sickness. So it could be something like an immunization, a screening for a certain health service, possibly even counseling for some high-risk conditions. For example, if a patient comes in for a screening mammography, we use code Z1231. That's the ICD-10-CM code for encounter for screening mammogram for malignant neoplasm of the breast. It means that the patient doesn't have necessarily breast cancer, but we're going to screen for it to make sure that the patient doesn't have breast cancer, or in some cases they might. Or imagine a patient's in for a routine visit for maybe follow-up care, and they also have their flu shot because, hey, it's flu shot season while we have you in here, why don't we give you a flu shot? So whatever condition they're being seen for, that gets linked onto that CPT code. Let's say it's an office visit, they're being seen for their diabetes, we use the diabetes code, we have their office visit, we attach it to that. But everything pertaining to the flu shot, we would use code Z23, and that's the encounter for immunization. And that separates out the medical necessity. Here was our office visit over here, and here's the reasons why we did that. And here's our immunization over here, and here's the separate ICD-10-CM code justifying why we did that. Now, the question I always get asked is, how do I know when to use a Z code? You're reading some sort of medical report, and you need to know what is it I'm looking for in order to abstract these Z codes. And unfortunately, there really isn't an answer like, well, if the record says this, this, or this, that will trigger you to use a Z code. There isn't like a if this, then that. Sure, there's some common ones like past history or past family history, but there isn't a straightforward way to say, oh, well, this is when you know how to use a Z code. Honestly, the best thing you can do is get familiar with your ICD-10-CM book and start looking through the Z codes, so that way you're familiar a little bit with what is applicable in the code book. And that way, maybe when you're reading an operative report and you see something, you can go, oh, you know what, I think I saw an ICD-10-CM code in the Z code section that this would apply to. Sometimes the provider might list them as part of the assessment and plan, but oftentimes the provider might not even know that a code for that exists, because it might be something that the provider incidentally mentions, like the patient has sleep deprivation or they're in foster care. So start looking through that section in your ICD-10-CM book. Also, if you look in the chapter 21 guidelines, they chunk out the different categories there, so you can kind of get familiar with what the different categories are. But essentially, the more you familiarize yourself with the Z codes, the more you're going to remember that the one exists. You won't have it memorized, of course. You're just going to go to your book and look it up, or go to your encoder or ebook or whatever tool you're using, maybe iCoder, and you can look it up that way. If you see something that looks like it might have some sort of clinical appropriateness that it would need to be reported out, go ahead and look through your codes and see if you can find something that fits that scenario. One area that's been a big focus the past few years has been the social social determinants of health, and those are our categories Z55 through Z65. So those are codes that describe certain barriers or situations that patients may have that might prohibit or just cause a little bit more difficulty or extra thought consideration to them receiving healthy outcomes. So it could be things like they don't have access to appropriate drinking water, they have a parent that's incarcerated, or their job exposes them to air pollutants. Addressing social determinants of health is really important because it allows healthcare providers to deliver more personalized and effective care. So understanding those factors like socioeconomic status, their education, their neighborhood, their physical environment, that can all help providers improve disease management and promote better health outcomes. For example, if we know that a patient is in a food desert and they can't get access to appropriate, fresh, healthy food, that they're eating a lot of prepackaged food, that can help us navigate some of those health considerations that we have for them. We can get them hooked up with the right nutritionist. We can get them hooked up with certain programs, Meals on Wheels, make sure that they're getting appropriate counseling, make sure that they're connected with the appropriate social services that they need, and even offer some preventative services to help mitigate those health risks in some of the communities that are underserved. Now, some of the Z codes that we have, like for example, the Z code for tobacco use, it might not impact our CPT payment, but it is still important to report them. There are some Z codes like an amputation status or an ostomy status that can have an impact on risk adjustment coding, which means there may be certain provider incentives and bonuses that are tied into the reporting of those diagnosis codes. But either way, we really do want to make sure that we're reporting out accurately and appropriately. So while occasionally missing a supplemental Z code isn't going to be the end of a world on paying that claim form for that CPT, we want to make sure as medical coders that we are accurately reflecting everything that's going on during that patient's encounter. Capturing everything appropriately is a big part of being a medical coder, and I am in fact in my medical coding era. And if you want to have a t-shirt like this that says that you're in your medical coding era, check out the link in the description for the Crafty Coder Chick. That's where I got this awesome t-shirt from. So thanks for tuning in today. We covered a lot on Z codes, social determinants of health, and the importance of them and how to recognize them the best that we can. Recognizing Z codes and understanding their wider importance of why we need to report them can really help out with our healthcare delivery. And don't forget that if you're looking to enhance your coding skills or just looking for a reliable tool, check out iCoder. You can get a free trial. So sign up at iCoder.info. Again, the link will be in the description. If you found this video helpful, don't forget to like, share, and subscribe. If you have any questions or comments in regards to Z codes, please leave them in the comment section below. Otherwise, I will see you guys in the next video. And until then, just keep on coding on.